The three things that I tell patients are: one is that I am desperate to help you. The second thing is we provide a type of therapy that is going to meet with their goals, their expectations, and what they hope to get out of their life. The other thing I tell patients is that our fight against cancer here, it's personal.
Disease and cancer don't just strike people, they strike people, their families, and their communities. And part of our job and part of our promise is to be able to care for all of those things.
At the end of the day, cancer treatment has to be personalized. What does it mean for that patient who's sitting across from you to say, what are your chances of this cancer coming back? Can you go and plan for the next few years of your life? Can you move on with life?
Basically, the war on cancer has to be waged by multiple disciplines, so surgery is only a very small part of it.
We also have some world-class, top-notch research that is constantly occurring in the field of cancer care, whether it be clinical trials or basic scientific research, where we're discovering the newest and latest gene that's going to result in the new and novel therapy for tomorrow.
The greatest benefit of the experience at Johns Hopkins is not only the surgical experience, but also that of the nurses and the technicians, the radiologists, and the other providers that allow patients to be cared for by experienced hands that have seen every variation of pancreas surgery and complications of the procedure. And it allows them to address complications in real time in ways that are less invasive and safer for patients.
The role of our multidisciplinary team in the Breast Center focuses on one primary thing, not just survival, but truly taking care of this patient so that her experience can be the least physically and emotionally traumatic we can achieve for her while ridding her of this disease. I think one of the key purposes of my role is to make sure that we always have an advocate for our patients. And that means we aren't treating the disease, we're treating the person and everything that comes along with that person. Whether it be that they're a school teacher, they have a child with autism, their mother is living with them, whatever other things are going on in that individual's life, they've now had a diagnosis of cancer added to it. There's a very high probability that after you hear those words, you have cancer, the patient only hears blah, blah, blah after that.
As a physician assistant, I have the most impact spending time with them on the phone or in clinic to listen to the problems that they're having, how they're feeling, and really go through those things with them and be of help.
I would say that I have moments of reward every day working with these patients. It's truly an honor and a privilege to be let into a patient's life when they are going through such a difficult time.
But also what's so important is we let these families and patients know that once they leave the hospital, we're still going to be there for them wherever they go, whatever state, country they're in. We will always be a part of their care, whether it's through a phone call, an email, any type of communication will be there for them.
I get Christmas cards, sometimes I do get birthday cards, so it's just a relationship that you have with the patient. I feel that a rewarding part of my job.
We have a culture here generally at Johns Hopkins, but perhaps even more specifically in our division of surgical oncology, which is a culture of the most collegial interactions, cross-pollination of each other's ideas, and true collaboration.
And that is really the goal of what we do at Johns Hopkins. We try to continually improve our clinical work by performing research.
Cancer cells are different from normal cells, but why doesn't the immune system recognize them and reject them immediately? Why do cancers form and why do they grow and spread?
There's new technologies that are being developed every week. There's new genetic abnormalities that are being found all the time.
I'm often asked why I would want to focus my career on pancreatic cancer, which is a pretty dismal disease. One of the things about it is that it's frustrating as a surgeon who does these type of things to realize that for a lot of patients there's so little that can be done. But it also, if you look at it the other way, it's a huge opportunity. There's a lot of room for improvement. And for somebody with basic science training and an interest in the biology, it seems to be the perfect place to focus your efforts because you can make such a big difference.
All of this is part of what makes Johns Hopkins a great place to practice medicine, a great place to care for patients.
To me, the promise of medicine is tailoring care to individual patients.
The promise of medicine to me means hope.
The promise of medicine is partnership.
To have a bold impact on the treatment of cancer.
Taking quality care of our patients.
Scientific discovery.
Healing.
It is the future for our patients to be able to be well again.
The promise of medicine is that this isn't our job, this is personal.